Thank you so much for attending Utah AIDS Foundation Volunteer Orientation. We really appreciate your support and your interest in volunteering for Utah AIDS Foundation. Well, let's get started. First of all, we're going to talk about our mission, vision, and values. Utah AIDS Foundation, through client-driven services, champions sexual health and overall well-being for those living with or at risk for HIV and other STIs. Utah AIDS Foundation works to achieve a future where everyone has equitable access to HIV and STI education, prevention, treatment, and care. Our values are safety, inclusivity, visibility, community, integrity, and dignity. In 1985, the Utah Department of Health reported a total of 17 persons living with AIDS in Utah. At that time, the state and most citizens were unprepared to address the HIV/AIDS issue. The need for public information and for assistance for persons living with HIV/AIDS forced a community-based response, which ultimately became the Utah AIDS Foundation. The first clinical diagnosis of AIDS was in 1981. Because AIDS primarily affected gay men, officials called the disease GRID. GRID stands for Gay-Related Immune Deficiency. In 1983, the term AIDS was selected to be the name for the clinical diagnosis. Now, I want to tell you a little bit about Utah and HIV. When the epidemic came to Utah, only 2 providers would see patients living with HIV, Dr. Kristen Reese and Maggie Snyder. They made it a point as part of their treatment to hug each patient after every visit. At that time, Holy Cross Hospital was the only institution to open their doors to Dr. Reese and Ms. Snyder and those suffering from AIDS. HIV in Utah today. There are approximately 120 new HIV diagnoses per year. Infection rate has remained steady since 2010. 75% of new HIV infections are along the Wasatch Front, including Salt Lake, Weber, Davis, and Utah counties. 3,000 people are currently known to be living with HIV in Utah. In 2012, CDC estimates 430 individuals living with HIV are unaware of their positive status. Utah ranks 36 out of 50. We are considered a low morbidity and a low infection rate state.
Volunteer opportunities. Food Bank. The Utah AIDS Foundation supports an on-site food pantry. Volunteer shifts are available Monday through Friday, 10 a.m. to 6 p.m. Responsibilities include stocking shelves, cleaning, and assisting clients. A separate test site orientation is required before volunteering. Utah AIDS Foundation offers free HIV and low-cost STI testing, syphilis, chlamydia, gonorrhea, hepatitis C. Test site hours are Mondays and Thursdays from 5 p.m. to 7 p.m. We now offer at-home testing in response to COVID-19 to reach the needs of those statewide. Outreach and education. Volunteers provide condoms, safe sex materials, and other party favors to bars, clubs, and public sex environments. We also participate in many tabling events, at different community activities, distributing educational material, and talking about the services we offer. Outreach and education volunteers are needed throughout the year, including Utah Pride, Queer Prom, etc. Events. Talented and dedicated volunteers are always needed and greatly appreciated for preparing and staffing our annual gala fundraiser, Red Party, and World AIDS Day events, Salt Lake AIDS Walk, and many more.
Policies and procedures. Ongoing communication. You will receive regular emails from programming staff members regarding selecting your volunteer dates and hours. These emails will often contain a web link to an online sign-up form. If a special volunteer need arises, you may receive an email or telephone call to gauge your availability. Depending on the volunteer areas of interest you have indicated on your volunteer application, you may receive communications from multiple different staff members. Confidentiality and sensitivity. As a volunteer of Utah AIDS Foundation, you will be required to sign and agree to our confidentiality agreement. In order to ensure clients feel safe accessing services related to their sexual health, it is paramount that we maintain strict confidentiality. Violation of our confidentiality policy will result in dismissal. Utah AIDS Foundation doors are open to all who wish to lead a healthy and sexy life. We value diversity and inclusivity and expect volunteers to treat clients and donors with dignity, respect, and kindness. Professionalism while volunteering. As a volunteer, you represent Utah AIDS Foundation and are expected to conduct yourself in a professional manner. Due to the nature of our work and the conversations we have with clients regarding sexual activity, volunteers must be aware of inappropriate, casual conversations as pertains to sexual acts or activities. Flirting with clients and seeking to form personal relationships with clients while representing the organization are cause for disciplinary action or dismissal. HIV 101. What's the difference between HIV and AIDS? HIV is human immunodeficiency virus. It is the virus that causes AIDS. AIDS is acquired immune deficiency syndrome. HIV can only be spread person to person. HIV is the virus that attacks the body's immune system. The 3 stages of an HIV infection are: number 1, acute stage, which is immediately after infection. At this stage, individuals are extremely infectious. Stage 2, clinical latency phase. This phase can last decades depending on the individual. Stage 3, AIDS, or acquired immune deficiency syndrome. What is an AIDS diagnosis? What classifies an individual living with HIV who has an AIDS diagnosis? The individual must have fewer than 200 T cells. The individual must also be HIV positive. And the individual must have 1 or more opportunistic infections or AIDS-defining illness. For example, tuberculosis, Kaposi sarcoma, and a rare pneumonia, amongst others. Terminology: harm reduction. Harm reduction is an approach to helping individuals achieve the highest level of positive health outcomes while meeting them where they are at. It's not about the best method overall, but the best method for the client. For example, utilizing syringe service providers to receive new equipment to eliminate the sharing of injection drug equipment, therefore reducing the risk of HIV transmission. Terminology no-nos. Use this instead of that. Individual, people, person living with HIV, rather than AIDS patient. Clinical AIDS diagnosis, rather than saying full-blown AIDS. HIV positive, rather than referring to someone as having AIDS. HIV 101 transmission. What bodily fluids transmit HIV? Blood, semen, pre-seminal fluid, rectal fluids, vaginal fluids, and breast milk. Transmission. An individual must come in contact with a mucous membrane or damaged tissue or be directly injected into the bloodstream from a needle or syringe. Mucous membranes are found inside the rectum, vagina, penis, and mouth. Condoms and lube are also great ways at preventing and reducing one's risk to HIV. Regular HIV testing and STI testing. If someone is sexually active, they should get tested at least every 3 months. Knowing one's status helps sexual partners assess risk. Communication. Individuals can avoid confusion and reduce stigma around HIV and STIs with potential dating partners and sex partners by communicating their status and current treatment. Sex positivity. What is sex positivity? All sex and sexual exploration, when it is explicitly consensual, is a great thing. Our goal is to support our clients and meet them where they are without any judgment. Sex positivity is the idea that people should have the space to embody, explore, and learn about their sexuality and gender without judgment or shame.
Champions of Sexual Health. Volunteer Donor Program. Sexual Health Champions is a group of dedicated volunteers who choose to support the work of Utah AIDS Foundation by making a gift of $5 or more each month. As a sexual health champion, you multiply your impact in supporting critical programs. It takes a true champion to commit to offering time and financial support to those in our community who need it most.
Thanks so much. Now, please complete the volunteer application.